The 11th order of the day is a motion on need for the intervention of the public health crisis of tuberculosis in Nigeria. Standing in the name of Honorable Benjamin Kalu. Honorable Kalu is invited to move the motion.
Thank you, Mr. Speaker, honorable colleagues, for this privilege to present the motion, because today is International Tuberculosis Day, and this motion borders on tuberculosis. I rise to move the motion on the need for intervention in the public health crisis of tuberculosis in Nigeria. The House notes that tuberculosis is a mycobacterium tuberculosis that affects the lungs, and over the years has been associated with mortality, even though it is curable and preventable. Mr. Speaker, honorable colleagues, the House also notes that the World Tuberculosis Day is celebrated annually on March 24th to reassess the efforts and encourage a strong engagement of stakeholders to end tuberculosis. The House further notes that tuberculosis is one of the top 10 causes of death and the leading cause of a single infectious agent above HIV/AIDS. And according to data from the WHO, in 2019, an estimated 10 million people fell ill with tuberculosis worldwide. B, 1.4 million people died from tuberculosis in 2019, including 208,000 people with HIV. C, tuberculosis is the leading killer of people living with HIV. D, tuberculosis is present in all countries and age groups. E, approximately 60 million lives were saved through tuberculosis diagnosis and treatment between year 2000 and 2019. Mr. Speaker, honorable colleagues, the House is worried that in Nigeria, a total of 127,000 people died from tuberculosis in 2019 and 27,000 people from HIV. The House is concerned that in 2019, an estimated 440,000 people in Nigeria were living with tuberculosis, of which 285,000 were men, 155,000 were women, out of which 83,000 were below 14 years of age. The House also concerned that multi-drug resistant TB, known as MDR-TB, is a public health crisis and threat, as a total of 21,000 people with multi-drug resistant TB were diagnosed in 2019. Mr. Speaker, honorable colleagues, further concerned that out of the 440,000 TB cases, only 120,300 were registered, leaving 319,700 undiagnosed and untreated cases, which could result in the spread of the disease in Nigeria. Mr. Speaker, honorable colleagues, the House is also worried that despite these realities, funding for the control of TB in Nigeria over the years has been largely donor dependent due to government's underfunding of the health sector, as well as its failure to fulfill its commitment under the Abuja Declaration of 2001. Mr. Speaker, the House is aware that in 2019, out of the $384 million required for TB response in Nigeria, $88,320,000, representing 23%, was provided by international donors, while only a meager $26,880 representing 7%, was mobilized from domestic sources, leaving a total of 268,800,000, which is 70% unfunded. And as a result of the underfunding of TB in Nigeria, a large number of health facilities do not currently have any form of TB services being rendered. Mr. Speaker, honorable colleagues, the House is further worried that although TB is a preventable, treatable, and curable disease, people living with TB in Nigeria often have to endure stigmatization and discrimination. Mindful that ending the TB epidemic by 2030 is one
Honorable Ningi, please see the chairman business.
It's one of the health targets of the United Nations Sustainable Development Goals, SDGs, of which Nigeria is a signatory. The House therefore resolves as follows. 1. To urge the Federal Ministry of Health and other relevant ministries, departments, and agencies to ensure effective and efficient implementation of tuberculosis-related policies, including improving government funding and ensuring the inclusion of TB in the minimum primary health care service package and other priority intervention in the health sector. 2. The House resolved also to urge the federal government to consider the inclusion of TB services into the benefit package of the National Health Insurance Scheme due to its qualification as a disease of high burden and public health concern. 3. The House mandates the committees on HIV, AIDS, tuberculosis and malaria control, health care services, and health institutions to interface with stakeholders, relevant professionals, and the public to determine the appropriate legislative intervention required for improved TB control and to mitigate the impact of COVID-19 on tuberculosis, especially the MDR TB, and also to effectively address stigmatization and all forms of discrimination against people living with TB, and report back within 6 weeks for further legislative action. I so move. Mr. Speaker.